We had a patient that came to us last year. He was giving a prognosis of around probably 3 months, no more than 3 months. He had already exhausted conventional treatments in regards to chemotherapy, radiation, surgery. He did all of that. He actually went through 3 different cycles of 3 different chemotherapies during his conventional treatment. Now, the tumors did shrink, but the side effects were so harsh that he could not continue on doing any more conventional treatments. So he found us actually through Mexican Cancer Clinics. Mexican Cancer Clinics was a patient advocacy center that studied their case before even getting to us, put him in touch with some of their patients that they've held in the past, and then they sent us all the medical information. We had a medical board meeting to review the case, and we approved the patient for treatment, knowing that we had a very difficult case on our hands. This was a lung cancer patient that had multiple metastases, and again, chemotherapy was not an option anymore. The medical board conducted an initial assessment where they further personalized the treatment plan that was proposed. We did some of our main treatments with him. We worked with immunotherapy, the use specifically of dendritic cell therapy, NK cell therapy. The fact that we do autologous immune enhancement therapies prevents us from finding that the patient's body will reject the treatment. Some centers do non-autologous because it's easier, but there's always a risk of the patient's immune system rejecting that external cells coming into their body. At the end of the day, we're working with live cell therapy. Every patient that comes to us gets enrolled in the follow-up program because it is very important for our doctors to continue to monitor the patient's progression, the patient's experiences. And we need that feedback because coming to the hospital is the first step in a much longer journey. Cancer is not something that arises in 3 weeks, and it's not something that is going to go away in 3 weeks. So that is why the doctor's involvement post-discharge is so important. We need to know what the patient's experiencing. We need to know how the patient's reacting to the therapy, and then we conduct follow-up testing to see what the next step is. This specific patient that I tell you about, being such a complex case, required more than 1 visit. He came to us 1 more time. We did another boost of dendritic cells and another hyperthermia, but the tumors have shrunk, the tumors have not spread, and the patient is living a perfectly normal life with no complications. So in our book, that is definitely a success case.